I'll let everybody get settled. My name is Jenny Hyam. I'm the Vice Chancellor here. And as always, I want to extend an extremely warm welcome to everybody that's here in the room and also all the people that are online. It comes as no surprise to me that you have generated quite an audience, Judith. It is fantastic to be here to hear your inaugural lecture. You are virtually a George's lifer, although you did do your undergraduate training both at Cambridge and close to the Whitechapel, which we'll probably hear about. But it's lovely to both see your work in the context of how much you've achieved. And I love the fact that your title includes partnerships, because we all know that marrying, aligning, making partnerships is so important throughout every aspect of one's career. So I thought it was a great title. There are so many people that we are welcoming here who have returned for this occasion, and that's also a really lovely thing. I have to take this opportunity to say a little bit of housekeeping. Number one, it's Judith's night, she'll do the talking. And after that, you will not have the opportunity to ask difficult questions, but plenty of opportunity to do so if you wish, over a drink and a few nibbles next door. Also, I'm very grateful to Tess, who has agreed to do the vote of thanks. So thank you very much for that, Tess. I have been looking forward to this evening for a long time because you have been so lovely to me, Judith, ever since I've been here at St George's. And you are one of the people that I met and I thought exemplified all the values. And I know that word gets bandied around, but I have found you the most extraordinarily kind, intelligent, sometimes challenging, in absolutely the right way colleague, and how valuable that has been, because you have helped me navigate some really quite tricky issues within the university. And I have never once not deeply appreciated those contributions that you've made on a personal level to me. So I would like to say thank you very much. And not everybody has it, and you certainly do. So I warmly applaud the fact that you have been made a professor here at St George's, and very much look forward to hearing what you go on to say. Thank you.
Oh, wow, what an evening. Thank you so much, all of you, for coming. It is such a pleasure to see old friends and current friends and some new friends who I've met that I don't normally work with as well. So thank you very much. Now, I found this talk quite difficult to do because I've got such broad interests, and being a general, I'm a generalist through and through. So I found it quite challenging to develop a coherent narrative of what I've done, because I've done quite a lot of things over quite a long period of time. But I know that all of you know a little bit about me. Some of you know more than well, pretty much everything about me, but I hope you all find something that you don't know about me to add to our relationships as we've worked over the years as well. It's a great pleasure to have family here. It's a great pleasure to have friends here. And it's a great pleasure to have the captain of the rugby club here as well. He's actually one of our students at St George's, so he's my mystery shopper on the medical course. So we don't tell his friends that. Okay, so what are we going to do tonight? I thought I'd just tell you about the things which have moved me and made me do things over my career. And when I talk to the students about professionalism, of course, I think about Sean's work on proto-professionalism, in terms of career and becoming a medical professional rather than professional in general, I quite like this very simple theory of socialisation through a community of practice into being a medical professional. It's quite dated now, it's from the cruises, but it will just give you an idea of what I'm trying to attempt tonight. So we're going to start off with my early influences, talk about my limited but some clinical research I've been lucky enough to be part of, and then talk more formally perhaps about the medical education and primary care since I've been at George's over the last 23 years now. So those early years influences. Sebastian suggested I should have a picture of Manchester with dark satanic mills and thunder and lightning coming down, because I think that's been his experience of going up there. But it does rain, but it's still a wonderful place to live. And Alex and Ewan have both been to university there, had very, very happy times there. My parents met in Lancashire and moved to Whitefield, which is near Prestwich in North Manchester, or the North as we used to call it when we were there. And I had a very sort of happy childhood, but very much localised to that part of North Manchester, with occasional forays into the centre, but never the south. So here's my parents, Terence and Irene. Quite an interesting background to their relationship. So mum came from a very affluent family in Yorkshire, but the 30s put paid to the family businesses, and so she witnessed her family go from affluence to relative poverty. She was a very bright woman, sadly died now, both my parents have died, and she got a scholarship to a secondary school in Harrogate, I think, but then had to leave school at 14 because the family needed her income from work, so she left work. Dad similarly was from Lancashire. I don't think was quite so enamoured of work, of school, and so but equally left about 14 or 15. And they met after the war, and after both of them had been engaged to people living abroad. So mum, in fact, was engaged to a GI in the States. She went out there to live for a year to marry him, but decided when she got there she didn't like him, and had a lot of fun and came back. And my dad was married to a Belgian woman who jilted him a week before the wedding. And so that wedding didn't go ahead. So it's pretty lucky I'm here, really. So that was their background. So you can start to see the sort of driving forces, particularly through my mum in terms of her ambition. They moved to Manchester. My dad was a hospital administrator, would be a hospital manager now. And really, I spent my childhood wandering around hospitals. Hate to think what the asbestos status of where I wandered was like, but corridors, basements, wards were very familiar to me. And he persuaded my mum to start working in the medical records department when I was 5. And then she never left, eventually becoming sort of deputy head of medical records in a big hospital. And again, I wandered around with her in holiday times and eventually got a job in the emergency department in my late teenage years. My brother, you can see up there dragged around as well, Derek, who's here today. He got used to dragging me around through his adolescence, and he used to take me to concerts in Manchester. Very pleased he took me to see Queen with Mott the Hoople, but I only wish I could remember it. And very cross with him for not taking me to the David Bowie concert that he went to when Bowie first played in Manchester. So a very happy family. Mum was quite ambitious for us, really, I would say. And you can see the house where we lived in Manchester up there. So then obviously schooling is very important. I just want to flag up lifelong friend Nicola there, who lives in Oxford now, who's a maths teacher, who was my partner in crime during childhood and adolescence. We did all sorts of things together, good things like run the Science Society at school, but some things I won't talk about today. My mum used very precious money to foment my academic interests, so I got World of Wonder while secretly lusting after a Jackie magazine. And also primary school as well. And at the grammar school, we particularly had some good female science teachers. And I enjoyed school, did well at school, and the teachers, despite really not that many women going to university at the time, encouraged me to apply to university and encouraged me to go to Cambridge, which kind of never happened really from that school. Now, at the time, Cambridge was just opening up to women. It was also beginning to take state school students as well, so you didn't need preparation to take the entrance exams. So I was very lucky in terms of time and place, and strategically applied for a college that had a lot of medics in it, and got in with my friend Tess, who's in the middle at the back there. And I think there were probably about 10 of us who were from state schools amongst 30 women, amidst an intake of 160 men and a college of 600 men. And so it was quite a time to be going there in all sorts of ways. So I've got ahead of myself, just move into Cambridge. I have to say I didn't really excel in my first year academically. And the text on my slide is really code for failed my exams in the first year. There was a lot of other stuff that I professionally developed in. I did a lot of learning about myself, how to manage work and play, but also just was exposed to a cacophony of newness, really, from quite a sort of quiet childhood to being exposed to Cambridge. It was quite a lot to get used to, and I think probably I spent the first year doing that, but then managed to rejig for the rest of the years, and fortunately didn't fail an exam after that, and had the happy possibility of doing social and political sciences in part 2, and that was a great positive out of Cambridge training. It was very heavily science-based. I think probably not the best place for me to go. Very much a people person, and I think probably I'd have done much better in terms of thriving on the course elsewhere. So the other good thing about Cambridge is that I met Tess, like Tess number 1, lifelong friend. Tess and Tess Harris know each other as the other Tess, but that's where she popped up in terms of friendships. And so on to Whitechapel. Probably very typical of most medical schools at the time. Excellent in terms of the clinical exposure that you got on the wards then. Very little in terms of didactic teaching, but we did get this drugs and therapeutics bulletin, which I really enjoyed, being a slightly nerdy self at the time. And it was the first kind of nugget of evidence-based medicine that started popping through medical school halls at the time. And of course, it was Joe who was behind that with Andrea Herxheimer. The London was a mixed experience. There was some, as probably most of my peers experienced, some very good teaching, but there was also some very negative teaching, quite a lot of harassment and bullying of students on the ward, so quite a scary experience. Discrimination in terms of progression, quite a lot of nepotism in terms of who got which house jobs and who got which attachments, etc., which I think was common at the time. So it wasn't the happiest of places. And I think to some extent it put me off hospital medicine quite profoundly, really, clinical practice and subsequently working in hospitals as well. But at the same time, some really good role models. Eva Alberman was a professor of epidemiology there and a very sane figure at the time, and I encountered her. And John Cunningham, who was my personal tutor. So it was a very mixed experience. And so I was feeling a bit lost in medicine until I did my final year general practice attachment in the 5th year. So I think we only had one attachment, probably at the time. But Tower Hamlets, where the London is placed, was a very exciting place for primary care. There was an exciting cohort of tutors, Sally Hull being one of them, sitting here. And I think, Sally, you've just been appointed as a lead for undergraduate general practice teaching as I probably came into it. And suddenly I think I'd met my tribe, really. They're very human, holistic, intelligent, progressive, thoughtful group of GPs in Tower Hamlets, and they are very concerned with improving the quality of care in what was one of the most deprived boroughs in the country, and they are very interested in using new technologies to improve care as well. So I thought I found my career at that point, and it was what Tess was doing, so I had to do the same thing. The other thing that was very exciting about those days is that you could do a lot of travel. And I think possibly we didn't have quite enough fun in the way that our medical students do these days when they go off travelling. But I did have absolutely fantastic times in India, in Calcutta, West Bengal, and then in Kenya, travelling with Tess, and then Bangladesh again, travelling in Tess for our elective, doing obviously learning in fact. So very appreciative of the experiences we had there. And so I qualified, usual experience of house jobs. I think that'll be a familiar experience for most people, and postgraduate training jobs as well. I think the most terrifying was paediatrics at Myland Hospital, whereas only doctor, no registrar, no consultant, neonatal unit, and an emergency department as well. So it's just me with a consultant on the phone, with cot deaths coming in, the babies being born flat, and you know, sepsis coming in. So I'm very glad things aren't like that anymore, and that there's increased supervision. Again, kind of put me off hospital medicine, I think. But happily, after their hospital experiences, I went to train at Chris Street Health Centre in Poplar, where more of these ambitious Tower Hamlets GPs are working, particularly John Robson, who had trained with Julian Tudor-Hart from Clynhorrig in Wales, and Candice Boomer led the practice, and later worked with Sally in the clinical effectiveness group at QMUL. Now, at the bottom is John's, I think, first randomised controlled trial, or it may be his only one, but it was a time when there weren't many randomised controlled trials, and he was looking at cardiovascular prevention in the primary care population, very much taking on Tudor-Hart's work, getting nurse practitioners to systematically measure cardiovascular risk factors with a view to improving quality of care, prevent disease as he went forward. So very exciting practice to be at, clinically excellent, encountering all of the challenges that actually are still happening today in general practice, such as estates, for example, but very, very inspiring. I had a great trip to Finland, funded by the BMA as well at the time. So those are what I like to call my early years. We're now getting to the early middle years, and I'd call myself late middle years still at the moment. So I was qualified as a GP, wasn't sure what to do next. I was kind of very interested in academic general practice, but felt I wasn't ready to do really at the time. And happily did a locum at the Lawson practice, and Debbie is here somewhere from the Lawson practice, but it was a very progressive practice in Hackney. In Hoxton, before it became trendy, it's rather a dangerous place. The practice was an early adopter of computers and using that to improve quality of care again. We did bruising 3-day weekends on call with no mobiles. There was quite a lot of domiciliary obstetrics because there were quite a lot of women who didn't want to go to hospital for care. So I remember managing a shoulder dystocia at home with a couple of midwives, etc. And we would provide the addiction service ourselves, so there was no intermediary, no organised community service. I remember doing lots and lots of blue scripts and so forth. And I also worked at a Health for the Homeless project in East London as well. Just want to thank other real peers from the time. Pat Hodinott was a GP in Tower Hamlets and later became an academic as professor at Stirling and works with Michael, who I've seen somewhere here. And Marta, who wasn't happy with general practice as a career, but she duly qualified as a psychiatrist and then became an academic at UCL as well. So a really good mix of people. So I'm just going to flip into the other aspect of supporting me through this time. During this time, several of us bought a house in Kentish Town, led by our friend Anne, who's on the right here. And we had a hoot of a time, really, living together during our sort of late 20s and early 30s. Lawyers and medics living together with a few other people coming to live with us over time as well. And my passion for swimming started at Hampstead Ponds. But there were also things which really impacted on my views of medicine, really, I think, as well. The horrible experience of losing Jim, who was a very close friend and an artist in 1990, I think deeply affected us all. who knew him. And I was in practice at the time, and it taught me a lot about professional boundaries in terms of patience and my own bereavement over that. My dad died a bit later, and just to mention this impact that we all have in terms of personal experience of illness, I think it informed my practice as an educator and my practice as a GP a lot. No need to go into details, but there was quite a fair bit around. But happy times is that I, at the same time, met Sebastian, who told me he was the 6th Rolling Stone, but I have to say, haven't seen any evidence of this yet. I'm still waiting to see Mick and Keith, but that was an absolutely transforming time meeting him and developing a family with him over the next 10 years. So lots of pictures of my lovely boys, Ewan, Ben and Alex, and very happily Charlotte joined the family around about 2013 before marrying Ewan post-COVID a couple of years ago. And a talk about my career wouldn't be complete really without the mums. So my mum was amazing. She lived in Manchester. It's a bit sad that my success had taken me to London, where the climes were warmer, but she was a devoted grandma and devoted to me, actually, just helping to bring up the children. And also Sebastian's mother, Valerie, who was amazing for us. She lived in Battersea. She brought her own children up. She brought her Sebastian's sister's children up, and then she brought our children up as well. And without her, we couldn't have really had the careers that we've had. Deeply loved by all of us, and sadly lost a couple of years ago. So thanks to the mums, my career progressed. As I say, I've been a bit uncertain about what to do after graduating, but really inspired by John Robson, who'd done an MSc at the School of Hygiene, and the work that he was doing at Chris Street. I sort of took myself off to the School of Hygiene and did an MSc, and really enjoyed the maths bit of me. Maths was through my mum, I think. Just really enjoyed doing a bit of analysis of a data set that Michael Marmot and Jenny Head and Tony Swerner had access to, which was looking at women's health according to mortality data. So at the time, there'd been some confidential reports indicating about the increased risk of death to people who've been born abroad, but I was able to add to that literature just by doing a small analysis with very little in the way of confounding data available, but just showing that there was indeed an increased risk. On the back of that, life is very funny in terms of circles it makes. I was then appointed as a lecturer in epidemiology whilst carrying on with my general practice. Worked again with Eva Alberman whilst I was at the Wolfson Institute, and very happily met Joan Morris, who was at QMUL at the time as a lecturer, and then later, to my delight, came to George's as a professor here. So really fantastic, important relationship whilst I was at Barts. And Alicia, I wasn't with at Barts, but was with Joan, and then Alicia came to George's. So they're really fantastic supports at the moment. So thank you for that. Now, not content with epidemiology and general practice in the family, I also did a public health training as well, and that was in Camden, but eventually decided by the end of the kind of 1990s that really I was doing too much. 3 children, 3 jobs, and all doing it part-time was a bit much. And then happily, a job was advertised at St George's, and so I moved over to become a lecturer at St George's. Now, we had a very integrated department at the time. There's no separation of general practice and public health and epidemiology, which was really creative. So we all mixed offices, could talk to each other a lot. And that was a really nice aspect of the job. Very grateful to Tess Harris and Sean for appointing me to that job. Later, the department split, but we were able to maintain very good relationships between PHRI and INBI. We have joint general practice meetings still. That's been an ongoing thing for years now, so that we can still continue to collaborate and share general practice and celebrate general practice as a profession. The other important people around at the time were Peter McCrory and Helen Mason. And Peter, with his usual charm, quickly engaged me in teaching on the graduate programme, which had started at the time as well. And I met Helen Mason, who also engaged me in doing lots of stuff around PCOS and teaching women's health stuff as well. Now, to begin with, I carried on with my epidemiological research, looking at women's health, this time with a bigger data set of about 28,000 women from East London, a combined hospital data set that allowed me to explore the findings that I'd found through my MSc around variation in morbidity by ethnicity. Advantages where we had ethnicity rather than country of birth, and we had lots of other factors around those women to see what was going on. And this time we're looking at operative outcomes and found much higher risk of operative deliveries in women from who were defined by someone, and not quite always sure who at that time, as being from an ethnic minority, once all of these confounding factors had been adjusted for. And Joan and I and others at QMUL, mainly not me, also did some work joining up screening data with that hospital data and looking at the value of different markers for Down syndrome as well. But I found it quite hard to kind of continue that research, and very happily collaborators here engaged me. I think my generalist skills with a bit of general knowledge of epidemiology and my pragmatism and my knowledge of general practice really hopefully contributed a little bit to some other trials that were going on at St George's. So here's Pippa and Sally Carey's work on home blood pressure monitoring, so a randomised controlled trial they did. I engaged with, and also doing some qualitative work for the first time, looking at people's experiences in that time. And qualitative work was just beginning to get take off really as a tool amidst the complement of research tools in research. But my other main collaborator was Tess, who engaged me again with my part epidemiological, part pragmatism, part grounded general practice skills to get engaged in her very important PACE Up trial, looking at physical activity and nurse interventions to increase people's physical activity as well. So I'm very grateful, and really it was a stellar experience of team working that I learned a lot from working with Tess. And finally, a couple of smaller pieces of work in a similar vein, working with Michael on his work with pregnant women and smoking cessation as well. Okay, so that's the clinical research I was involved with, and I'm going to move over to general practice and primary care and education now. The RCGP have just changed the definition of a general practice. I think they struggled with the definition for months and months in dark rooms, but they've just changed the definition. I think probably all of you know that I'm pretty passionate about general practice. I really enjoy the combination of clinical care, undifferentiated presentations, continuity of care, whilst also having a population perspective on the people who are registered with you in a practice. So you're doing kind of three things at the same time, dealing with acute issues that come up, dealing with chronic issues, but also planning care as well. So it's a great place for students to learn, but it can be a bit haphazard in terms of what they're exposed to. And there are all of these demeaning ideas that students will just see colds and flu when they go to a GP. And sometimes that can be true if they're in an acute care type of thing, but it shouldn't be like that. Now, I'm very grateful to all my colleagues at George's that have absolutely fantastic placements for students, really carefully thought out and delivered. And this is some of the feedback for the placements that Nicola and Sangeeta and Adrian run. And very grateful to Melvin, who's here somewhere, who looked after all the placements during the nightmare of COVID when he led up the primary care team then. So thank you for that. But in terms of thinking about primary care, we have got a problem. We've got a workforce crisis. We've got students who witness that workforce crisis in general practice, and we have stigmatized experiences of what they're learning is in practice at times. And I think there's a lot more that we can be doing to really demonstrate the complexity, fun, fascination of general practice to students. So this is a paper, and forgive the colour, it wasn't our choice, that Rora, who's a clinical teaching fellow, and I did just before, well, just at the end of last year, just thinking forwardsly about how we can engage students more with general practice so that they're enticed into it as a career. So, of course, there's the acute and chronic care that we deliver in general practice that they need to witness and deliver, and to see the complexity, to see the medical fascination of the cases that we see. And of course, they need to see the life course of those presentations. And last week, I talked to someone who'd had a neonatal death and talked to people with dementia, and the students saw the whole thing within the same surgery. So those are fascinating parts of it that we need to systematically plan them being experienced, being exposed to. But there's also the service management, as all clinicians have, service improvement, which needs to be constantly running, and the leadership skills that GPs have as well. And I think on reflection, actually, what's missing there is the health promotion side of things as well. So thinking about that population care, looking at how we organise care to get immunisations done, to get all of those things that John, Sally have been working on in Tower Hamlets, and everyone has been working on in general practice across the country. So how can we do that? Well, this was a very important publication around about 2016 called the Bass Report by Val Bass, who's an academic at Keele, previously Manchester. And I think she really set out, much better than I ever could, all of the steps that we need to think about taking to encourage students to actively choose a career in general practice and not feel that they're being coerced into it just because of the numbers game. So she talked about a lot of steps that need to be taken, that I particularly wanted to focus, really, these are my domains, just thinking about prior experience students have, the formal curriculum, the stuff they get taught that we don't plan them to be taught, making sure that's very positive, the hidden curriculum that they witness if they're with a GP on a bad day who's fed up of the job or see some problem in practice and don't understand the context of it. And then the things that other organisations outside medical schools perhaps can do to entice them into the career as a practice. So the lens with which I'm just going to talk about the things I did as a GP, think through the VAS report really. I've tried to sort of tie them into things which are going to impact on students. So the first thing is, have we got students who are in a place where they can learn? And I really learnt all I need to know about that from mentors Aileen and Deborah Bowman, who were actually deans for students, and I supported them over a number of years, dealing with students in difficulty and for all sorts of reasons, but perhaps who also sometimes weren't behaving as they should be, but also those who are ill, etc. I think that's one of the hardest jobs in the institution, to be honest, actually. The things which the dean has to deal with requires enormous skill, support, planning, etc., supporting remediation, supporting students, but also knowing when lines have to be drawn as well. So very, very tough role that both Aileen and Deborah were just excellent at, and I learnt a lot from. During that time, we got a bit of funding, and this was perhaps ahead of the media game, really, for some consent training. And I think it was around about 2015. We were, I think, one of the first probably to introduce some peer-led training for students on sexual consent when they became students. That was an institution-wide thing. That was obviously with colleagues as well, so Margot, Gavin in student services as well, and our students who were just fantastic at delivering that training for each other. And then finally, the great thing about working around the deans at the time was that Leander, who's here, was head of the pastoral care for students and absolutely amazing lead for MBBS personal tutoring. So that was one very good thing that was happening at the time. And obviously a lot of these students needed that care at the time. But the other thing was being in the office with Deborah and Leander and hearing the peals of laughter that came out all the time. So that was a great thing to be around. So that was an institutional wide role, wasn't just medicine, taught me an enormous amount, very important for thinking about leadership as well. So narrowing down a bit to MBBS, I've always thought it's really important to have GPs in senior leadership roles. And here we've got Shella, who's our Director of Curriculum. We've got Simon at the back, who's leads on assessment and our first module that students get when they come into medical school, which is fantastic. But I had some roles initially as, leads on various parts of the curriculum, but then had the privilege of being Deputy Course Director, first of all with Pippa and then with Hannah later on. And that, again, has been a tremendously formative experience. I can't quite remember what I did. I do remember there are an awful lot of emails, an awful lot of things to sort out all of the time. And there's this vague thing called COVID that was very consuming for some time in terms of directing teaching. But these are just a fabulous team of people to work with. And thank you very much for the privilege of that. I've got a couple of administrators here who are really there as ciphers for the MBBS programme team, all the administrators who are amazing to work with, too numerous to name tonight. But thank you, Joanna, Paula, can see Stephen there as well, and Fiorella, couldn't find a picture of her anywhere, that was a flower. And then other leads such as Debu and Kevin for assessment as well. So lots of stuff to do with the whole programme there. Jenny kindly asked me to be the lead for the outgoing MBBS International programme, which brought some interesting new challenges and which I had ownership of as course director as that programme was being run out. And that was a great privilege to work with those students who come across the world to be on that programme and just see them happily through the end of their training into being doctors. And then Pippa I've worked with such a long time now, but it's been great working with you, and we've worked on particularly the University of Hertfordshire franchise together, and Pippa does a wonderful job of keeping the whole clinical education unit going. So that's been fun to do as well. So lots of leadership experience doing that. So going back to our Val Vass hat, just thinking about different competencies, Kathy Burtico was around for a time working with Peter McCrory and others on the UNIC franchise and also on MBBS, and David Oliveira being course director, and had some visions about a new assessment domain that we needed at St George's. She could see very clearly, I think, where the direction of travel was going from the GMC, and so we implemented a new professional assessment to accommodate those needs for the GMs, for the medical programme, as the GMC curriculum was going to expect. Now, it was quite a sort of complex assessment domain. There's something funny about my brain that managed to get this going and operationalise it, and at times it often felt as if I knew what was happening but nobody else did, which probably has a lot to do with my communication skills. And again, it was a really useful leadership experience. Not least because it taught me to consult widely when you implement change. And I can publicly apologise to my administrator colleagues when I brought this in, because they very much started drowning in paper about a year after implementation. So that was a good lesson learnt. And I think probably we didn't quite get the tone of the assessment domain right straight off as well. We intended it to be very much supported, remediation focused assessment, but I think the students experienced it as punitive and perhaps a bit Big Brother at the time as well. So it took some time to get that settled in. And I think I learnt a lot about that implementation, particularly communications, from doing that. It was one of those things where the GMC loved it and the students really hated it. And so GPs being visible in the curriculum, teaching things. I've always had a good kind of sniff around things that we didn't cover that I felt we ought to cover. And there's just a miscellany here of things that we did during my time at various stages. With Leander, we had some brilliant times devising some teaching for the curriculum, had some famous teaching sessions. I can remember a student fainting while we tried to teach one day, and one of us had to go off looking for trolleys while the other one carried on the session. I've always been interested in communicating numerical risk, so it's been part of my maths interest, really wanting patients to make informed choices down to the nitty-gritty of whether or not interventions are valuable for them or not valuable for them. So with Leander and Catherine Yerkes, we introduced some role modelling around that for PE, which was, I think, really useful. Latterly, Umar and I are doing some work on trying to scope and look at the inequalities teaching that's happening in the curriculum. And outside George's, I've been doing a bit of work initiated by Helen really at the start with Verity, the charity around teaching professionals about PCOS and working with patients around that. So I've talked a bit about leadership. And I just wanted to share a few other things in terms of my own experiences. I was very grateful to St George's for putting me through a leadership course when that was first implemented. And Judith is here who taught us or mentored us, so thank you very much for that. Obviously you've seen all of the leadership experiences that I had at George's. Practice I haven't talked a bit about yet. I hope I'm not taking too long to go through this, but I will mention the practice in a minute. But I also just want to say thank you to Lucy for inviting me to join the board of something called Compass Wellbeing. Now, Tower Hamlets, as I've said, was a very diverse, very complex, very deprived neighbourhood. The psychologists have always been an amazing group of people in Tower Hamlets, and Lucy's predecessor had set up a community psychology service that actually worked in practices, seeing patients with GPs in practice, but also with a tier 4 provision for complex patients as well. And they managed to extract themselves from BARTs because they didn't like working with BARTs. I hope that's okay to say. And became a social enterprise to deliver talking therapies for Tower Hamlets. Lucy knew of my interest in mental health. We'd been trainees together back at Chris Street. And so she rang me up and said, will you be on the board of this new social enterprise we're setting up? So it was absolutely wonderful being part of a high quality social enterprise, not for profit, really focused on delivering high quality talking therapies care to the population of Tower Hamlets. And it was a very formative experience going through an NHS tendering process that was very painful and ended up with Compass for probably all sorts of interesting reasons, not being reallocated the tender for talking therapies in Tower Hamlets and a different provider being chosen. And I have to say, this process of reprocuring services is very disruptive to NHS care for patients and very disruptive to organisations as well. And we had a challenging time going through that together. Lucy was absolutely brilliant, looked after all the staff, etc., but it's still happening. And in fact, Ewan's wife, is a speech and language therapist, has just been through this process in Warrington. And I think they were left for a month after the reprocurement with no notes, no appointments for patients, no follow-up of previous patients, etc. So just a flag, that's an enduring issue going forward. Good for leadership training, but not so good for patients, I don't think. And finally, I've been secretary of the HODS group for SAPC, Society for Academic Primary Care, and that has been a delight and a fascinating interest into the whole academic world of general practice across the country. So having had some leadership experience through good and bad and some training, I work with my lovely colleague Aileen to really think about scoping leadership across the MBBS curriculum, because again we could foresee that it was going to become a GMC requirement. So we had a look at it with some colleagues, scoping what students did and didn't know about leadership, and then implemented a series of interventions across the curriculum, across most years now. I think we've got it, looking at how we deliver teaching. So we started off with a student staff partnership grant, found out a lot of the students never thought of themselves as leaders, had no intention of becoming leaders in future, thought they were going to be doctors and that was it. So that was a very good thing to find out. And then intervening with some project work, some lectures, sneaking little bits of management in through Tessa's case analysis project, and final year lectures with Penny and in the public health group as well. And Adrian and I have just had our first pilot of a leadership and management placement for students, placing students in practices for 5 weeks at a time. Also being present for students in a variety of ways is really important, and I've had the pleasure of supervising lots of different projects over the years. Some of these are my favourites. I had a student who made a great video on diagnosing death, how to do it. No dead patients were involved, I can assure you. It was all acted. We had a wonderful final year student who did her elective, making a film about general practice a couple of years ago, and won the SAPC elective prize winner. And you can have a look at the QR code and have a look at it later. And then, you know, a whole variety of different things students pop up with. You know, there was me doing something on carbon monoxide with Virginia Murray, who's Mrs. Poisoning in the UK, as part of a student project as well. So wonderful creative ideas that students have. I've mentioned SSPGs already, and thanks to the student experience team for funding these projects. They allow us to work with students to develop bits of the curriculum we're interested in doing. On the right is the leadership one, on the left is a more recent one, where we have been trying to address the problem that students don't feel confident about how to do large handovers when they go into foundation practice. And I've been working with Jackie at the back and some wonderful students who've just qualified as F1s, Jonathan Round as well, to talk to those students about their experiences and think about a teaching intervention we can do to make those students feel really confident when they hit foundation rounds, being able to hand over patients and hear what's happening with the cohort of patients they're looking at. Also got to think about how general practice is changing. And again, you'll start to see these younger GPs popping up here now. So Umar Chowdhury was one of our ST4s, academic GP. Roa was one of our ST4s, academic GP. And these were their projects as they that they did. Very valuable for St George's, very valuable for them as well. Looking at how general practice is changing in terms of remote consultations and how we should be teaching those. So great projects, both of them. And then looking forwards to the future, this is quite a lot of what we've got on the boil at the moment in terms of ideas and implementation. So we've implemented this year some remote tutorials for students in their final year GP placements who are often miles away. You know, we have students going down to Bognor Regis, having a wonderful time down there, but no contact with us. And again, just role modelling the fact that GPs do know something about prescribing, they know something about investigation of disease, and teaching to the level that they need for finals, coming up to finals as well. Umar and I are thinking very much about inequalities and equity in primary care and how to get students thinking about that, almost diagnostically perhaps, when they appraise students. Ro and Stephen and Sheila and I are looking at out of hours, led by Katie at the top, thinking about trying to get students into out of hours placements, possibly LAS, possibly out of hours within St George's or at the local ambulance control centre. Going to be very difficult to implement that, but we're having a go because we think it'll be fascinating. Just those interfaces about when to admit, when not to admit, that kind of experience. We're working with our colleagues to try and get a footprint in specialty systems teaching, because we do a lot of psychiatry, we do a lot of gynae, we do a lot of peds, we do a lot of general medicine in primary care, and yet we don't get involved in the teaching of those intellectual disciplines perhaps as much as we should be in secondary care. So we're building relationships to try and start doing that again. I've mentioned leadership of management, and I think I've mentioned quality improvement as well. And these are my very wonderful colleagues that we're thinking about delivering those projects in. But I want to give a special shout to Stephen, who's the lead administrator for primary care, without whom any of this would have been possible. Actually, having somebody back as a lead administrator for the primary care education group has been transformational. So thank you very much, and please don't apply for any other jobs. This exciting thing, really, which is just about to happen, is, I have to say, plagiarised from the School of Hygiene, who had a really fantastic series of primary care seminar lectures, which was global last year. Really fascinating talks. We thought we would try and attract students into general practice by having some grand rounds on primary care for students as well. We got some students involved for another of these interactive grants, and they very quickly told us that grand rounds and all the ideas we had for topics were very boring. So we changed them, and we've now got a really fascinating set of seminar series coming up starting on the 31st. So again, please do register for that and see what you think. We think they'll be suitable for schools, students, and also GPs as well. So let's think about clinical attachments and practice. And I am on the home run now. I don't know how long I'm taking, but I just really wanted to give my big thanks to Minute Green, a wonderful practice in Brixton where I work. And you can see my current partners and managing colleagues at the bottom, who are just the best. It's a very challenging practice to work in. There's a lot of difficult things that happen in that community. People have a lot of financial, psychological, physical, housing, crime associated problems. And on top of that, they often have health problems as well. So it's quite hard for our reception staff, for our admin staff, for the doctors, the nurses, and the HCAs. And they do an absolutely fantastic job. And you can tell that because Nigel, who set the practice up, he took it through 2 estate changes, died very sadly around about 2012, 2014, very suddenly of a subarachnoid hemorrhage. And it was just the most terrible time. It was terrible because we were grieving, just really sad about him dying. And we also had 8,000 patients who were grieving as well, and who came to tell us that they were grieving. So very, very challenging. But they wrote lovely, lovely things about the importance of a GP to them, how that GP as a witness, as a container, as a repository for life was very important. And I think it's just really important to flag that up to our students, but also to reflect on ourselves at the moment, because it is disappearing somewhat as pressures are put upon us to see patients instantly for every condition that they have. Continuity and fragmentation, continuity is being lost and fragmentation is increasing. But actually, it's really important. I really liked the comment at the top left. So somebody says, Dr. Conson's given me lots of very good advice over the last 30 years, and I haven't followed any of it. Other lovely comments about being cared for, caring for lots of bits of yeah. So Nigel set the practice up with that ethos. Nicola Beck, who is happily here as well, I worked with and was a partner of Nigel's for many, many long years. And just want to say a big, big thank you to everyone I work with and what a great team we make. So final slide, another slightly serious note. If you think that what you've heard is important or useful to education or to primary care, most of what you've seen has been collaborative, and it has involved academic GPs. However, despite being the biggest clinical workforce in the country, academic GPs are the smallest proportionate cohort of that workforce. So we put together some data at SAPC last year because we're very concerned about this. And you can see that compared with general medicine and other specialties, the proportion of the workforce who have an academic training of any sort is much lower, akin to anaesthetics. I think that's got a bit better recently, and psychiatry doesn't do too well either. So we'd really like to do something about this. It's a complex issue, something to do with general practice clinical training being very short, there not being time to do academic training as part of your general practice training, compared with the 10 years or so that consultant training takes in medicine. But there are other funding, political issues as well that impact on it. So we are on a bit of a journey to try and increase the number of academic GPs because we think they're important for education and for the service as well. And these are all people who've been through the academic general practice programme as fellows. So these are people who've had an extended academic training of 4 years rather than 3. And most of them, I can't think of anybody who's not working in leadership roles in primary care in London since they trained here. So, for example, we've managed to get 2 NHR in practice fellows. Felicity and Mohammed are both currently fellows, which is astonishing, but were previous ST4s. Lisa works at King's, was here as an ST4, and you'll see lots of familiar faces for people who are employed at St George's who've come on to other programmes as well. Now, until recently, we had a regular trickle of ST4s into general practice funded by HEE, now NHSE, and unfortunately, they decided to stop funding those posts. So we're not going to get our regular 2 trainees per year coming into the department. Tess and I have worked very hard this year. Well, Tess worked very hard with all of her career supporting the application, but we had a really good go and managed to get one of the competitive NAHR posts. There are only 12 across the country to come and join us next year. And we have 1 locally funded post, but next year there'll be no locally funded posts. So we are very worried about what's going to happen to general practice, academic general practice, and the teaching of what's going on. So if you know anybody to talk to or can influence this in any way, we'd be very grateful. And it's not just an issue here. And in fact, London, to be honest, has been very well protected in terms of the supply of academic GPs compared with the rest of the country. It's a big issue across the country. So I want to say a final big thank you to you for coming and joining the celebrations tonight, and hopefully you know a bit more about me than you did before. Big thank you to all of my colleagues who are here tonight. It is fantastic working with you, and that's why I'm a George's lifer. And I just wanted to say a special thanks to family and friends who are just great supports at home and have supported me so immensely over the last years. So we've got swimming friends over here and the mums who we go regularly away with, and my book group and lots of family as well. So big thank you to you all. So my thank yous to Jenny and the team who really supported this evening as well, particularly June for seeing me through the whole thing. And I'm just going to put this on, but Tess is going to say something. Thank you.
So I'm absolutely honoured to be asked to give this vote of thanks for this remarkable yet very, very modest colleague of ours. And you can see from this lecture tonight just how much she's achieved and how inspirational she's been and how much St George's has to thank her for. So I've known Judith, as she said, since she came for her interview in 2000, and I knew immediately she was going to be a great colleague, although I didn't know until tonight that we both had the same academic influence of Jackie as, as young women. So that's another thing we've got in common. I'm still blown away by what she's managed to achieve, though, since her time here. It's phenomenal. She's worked so hard in medical education, and she's brought rigour and to assessment, evaluation and curriculum design, which you can see, whilst always listening to the student voice. That's always been so important to her. In the same way, she's always had the patient at the heart of her passion for general practice. And I think that comes across in all of what she said tonight. And she's championed equitable primary care, embraced multidisciplinary working to always strive to improve primary care. And she's continued Sean's work in absolutely embedding primary care firmly in our medical undergraduate curriculum, and has been a fantastic role model for general practice. And so many students have wanted to follow in her footsteps, which is great. She's also, as you can see, passionate about postgraduate academic training, and she's been a wonderful mentor and supervisor to so many young academic clinical fellows in her time here who've gone on to successful careers, and many of whom are here tonight, and we'll get to chat to them later. So we shared an office for many years, which was a very happy time, and we worked together on research and education. We bounced ideas off each other, swapped books. And then there was this division of academic primary care, and those who were interested in education became part of the Institute of Medical and Biomedical Education, and those of us who were interested more in research were part of population health. And Judith widely foresaw the danger of this division and how it could absolutely fracture primary care within St George's. So she instituted and drove these monthly primary care academic meetings, which you saw her talking about. And those have been so important in helping us to maintain our identity and strength in St George's. These meetings continue, and they provide such a vibrant space, both for trainees and for established academics. We all appreciate them. We're able to share ideas, research findings, have support and networking. So thank you for that, Judith. It's been very important. And as well as all those roles in medical and primary care, undergraduate and postgraduate education that you've seen at St George's, she's also been a very important player on the national primary care stage. And her work as secretary for the Society of Academic Primary Care Heads of Department Group has been going on for many years and has been very, very well appreciated. And she talked about the new series of online education seminars, which we're all really looking forward to. I think these are likely to be nationally and potentially internationally lauded. So great initiative for us at St George's to be very proud of. So these are the thanks for Judith's very many solid achievements at St George's. But what's also really important to remember about Judith is how she quietly supports and facilitates others to achieve their dreams. A true leader. And when I was asked to do this vote of thanks, I asked colleagues to say a couple of words about Judith. What did they think of her? And I thought their words would make a really good end to this vote of thanks. Too many to list them all, but they broadly split into three groups. The first was around her as a visionary, clear thinking, wise, thoughtful, open-minded, future-focused. The second around her engagement with others, collaborative, approachable, kind, conciliatory, an excellent communicator, and always multidisciplinary. And the third are about her values, always acting with integrity, ethical, against inequalities, honest, fair, a role model. So heartwarming that I've actually in a little word cloud. So Judith, it's thanks from St George's for all you've done for our institution, from all your colleagues who love working with you, and from your grateful students and all the academic trainees, and from me. So lucky to have you as a trusted, wise colleague and a loyal, wonderful friend for all these years, and hopefully for many more to come. Thank you.